And how can the state and the House of Delegates help support access to healthcare? We have so many people that don't have access to healthcare and they don't have an option. And that has a direct impact on many of the things that you've mentioned, including COVID and many other diseases and many other problems that cannot be addressed unless you have access to healthcare.
Yes, I've gotten my two COVID vaccines and my two boosters, all four injections through the Maryland Department of Health. And I found it pretty easy and pretty efficient and pretty easy to use. I didn't have to wait very long for any of those injections. And I went to them. I chose to drive, but I could have walked to the site where they distribute the vaccines. However, not everybody avails themselves of that, and there are health issues beyond COVID that people face. My position is everyone working in Maryland should have four things: a living wage, health insurance, a contract, and a pension. And health insurance is very important. It is not mandatory that all businesses provide health insurance to their employees still. That's why we have the Affordable Care Act at the national level, so that people can join not cooperatives, what's the word they use for the pools of healthcare? It slips my mind right now. But anyway, they can go through the federal government and get themselves some health insurance. You can't live without health insurance. That's for sure. So more people having access to health insurance, everybody being insured, is good policy. It's not only good for the individual, it's good for society in general. Because what happens is when people don't have health insurance and they feel sick, they will wait until the situation becomes acute and they're desperately sick, and then they go to the emergency room. Well, treating an acute illness is a lot more expensive for the system, for all of us, than preventative medicine or treating an illness when it first begins. And emergency room services are much, much more expensive than being able to visit a clinic or visit a doctor when you first begin to feel symptoms. So actually, we end up paying for the uninsured. We all do, because our rates go higher. The hospitals have to be able to cover costs of people who are uninsured, and they pass those costs on to those of us who are insured. So there's a public interest in everybody having health insurance. And, there may still be some people out there saying, if my neighbor wants to go jet skiing and breaks his leg, why should I pay for it? Well, you've got a point there. But when we're talking about something like COVID-19, a deadly airborne virus, then you certainly have an interest in keeping your neighbor healthy. Now, what the state can do about this, the state has a great deal of control over Medicaid and Medicare, and the state controls what types of services in their state are covered and to what extent. So through Medicare and Medicaid, the health systems for the old and for the low income, expanding those types of services and making sure they're funded well and that people have access to them and know about them and can take full advantage. The state can do a lot to promote healthcare, at least among the poor and the elderly.